My name is Meghan Brockman. I am Clarinda Regional Health Center's cardiopulmonary rehab nurse. I graduated from Glenwood Community High School. From there, I went on to Iowa Western in Council Bluffs. I got my RN there, so registered nurse. And then I worked for a couple of years, and then I decided to go back and get my bachelor's degree from Clarkson College in Omaha. So my why is I like helping people. I like to see them improve themselves, also see them, as nurses, we see people at their worst. So seeing them get better throughout a couple days, even a couple hours, we get to see that they have improved, and being a part of that and being part of a team that helps improve patients' health is one of my main goals, and that's why a reason I got into nursing. So some technology advancements that we have for cardiac rehab when patients come, but first about 6 weeks, we put patients on heart monitors, which we can sit and observe the patient's heart monitors throughout their exercise routines. And then with cardiac rehab, there is a national group called AACVPR, and our cardiac rehab is certified within this program, and we have to update what we're doing throughout our program every couple years to make sure we are following the national guidelines. And it also helps give us new education for patients, say with diabetes, smoking, blood pressure. It just keeps us up to date on what we need to do to help our patients and to help them get better. What I would say would help me be a good cardiac rehab nurse is setting aside that I do have a little bit of exercise background, so that does help me make a good exercise program for our patients, which we build on throughout the program. So every month we are not doing the same exercises. We change that, make it more challenging for the patients. We don't want to keep them sedentary with just doing the same exercise every day. My husband does live here. He is a farmer, so I had to make the move to Clarinda. Granted, growing up in Glenwood, it's only an hour, but it's still kind of a big move for me. So moving to Clarinda for my husband. And what keeps me here is him, clearly, and his family, but also from being from Glenwood, I did work in the city. So I've worked at the bigger hospitals, and my first job was at Bellevue Medical Center, which is partnered with UNMC, but it also is a smaller hospital. And I liked the fact that I worked on the med-surg floor, but I could go down to the ICU and I would know some of the nurses that were there. So knowing a face helps a lot. Then I also worked at Bergen Mercy, which you walk in there and you're like, okay, who is that person? Because you don't see their face every day. So coming to Clarinda and being able to work in a small town hospital is very rewarding in a sense that I walk over to the main hospital and everybody says hi, and I know them by their first names. And I like that aspect about Clarinda Regional Health Center, is because even though if you are a new patient, everybody still remembers your name and remembers your face. So being able to feel comfortable around employees, coworkers, and in the community, and being able to say hi and have a conversation with my patients and relate that back to how we are a small community and everybody wants to see everybody improve is very rewarding as well.